Good afternoon. My name is John Toronto, and welcome to Afrique Today. Today, we're going to be talking about the coronavirus vaccine. Keep in mind that on Afrique Today, you can watch us on the web. You can download the app. We're also available on Fire Stick TV as well as Roku. I have excellent guests with us today, Dr. Davis and Dr. Otiji, and I'll kick it to Dr. Davis to introduce herself.
Hi, everyone. So good to be with you this afternoon. I'm Dr. Keisha Davis. I'm a family physician in Maryland. I'm also a vice president of health equity for a company called Aledade, and I continue to see patients at a small practice in Baltimore. I'm also the co-host of the podcast, The Sisters Will See You Now, and we recently did a podcast about the vaccine as well, and I'm really excited to just talk with folks and clear up some myths and misconceptions about the COVID-19 vaccine. And I will turn to you, Dr. Otiji.
Hello, everyone. My name is Dr. Adora Otiji. I am also a family physician practicing in Upper Marlboro, Maryland. I am originally from Nigeria, but I've been living in the United States for over 20 years now. So, but definitely very excited to be here to hopefully share some information. I also had the privilege of serving as a vaccine science fellow with the American Academy of Family Medicine last year. So thank you for having me.
It's fantastic to have you both. And I'm John Toronto. I'm also a family physician with a background in community and public health. So I'm going to throw this to Dr. Otiji first, because given your background in vaccines, one of the things that I've heard, and I'm sure you have as well, is why should we trust a vaccine that's been created so quickly? Normally, it takes years to develop a vaccine. Why has this vaccine been able to be produced so quickly, and why is it safe?
Hi, John. So yeah, it's a great question, and definitely I will allow Dr. Davis to chime in as well. But I think one of the things that have led to the rapid development and production of the vaccine is the new technology. So the COVID-19 vaccine uses the mRNA technology, which has allowed things to progress really quickly. But still being able to preserve safety and, of course, efficacy. That's the whole point, is that it has to do what it said it's going to do. But the primary thing is that it has to be safe. Otherwise, there's no point. And so I think definitely the science and the technology has allowed the rapid development. The science is definitely something that's been around for a while. I think they were just waiting for a new kind of novel vaccine so happened that the pandemic happened at this time. The need was there. Obviously, this is something that it's a worldwide pandemic. And so thankfully, we had the technology that was just ready, available, and it was ready to go.
Yeah. I think two things with that. One, here, what Dr. Otiji was saying, that this was already in production. So mRNA vaccines are something that have been in production for a while, been rolled out yet. And so the science was already there. And then this came along and it was kind of the cherry on top of the ice cream that, that the sundae was already built. And so they were able to just put this in. I think the other important thing to remember is to understand that steps were not skipped in the process. So what they were able to do with this, Operation Warp Speed, and honestly, a large infusion of money and time, was to be able to speed up some of the steps. So how a vaccine comes from, idea to getting into people's arms is there's phase 1 trials, which is really just, is it safe? Can we give this to people without harming them? And then phase 2 is, does it work? Does it, offer some level of protection? And then phase 3, how much does it work? How much, what's the level of protection? Is it 50% effective, 80% effective, 90% effective? And so they were able to collapse some of those steps. And so, they did phase 1 to say, is it safe? And then we said, okay, it's safe. And then let's do phase 2 and phase 3 at the same time. We're figuring out, how effective is it? What's the level of effectiveness? Then they took another gamble and said, while we're figuring out if it's safe, we're taking a chance, and we're going to start ramping up production of this before we've even figured it out. There's a gamble there. And you've seen there have been some vaccines that have had some fits and starts. Pfizer and Moderna have kind of gotten across all of those thresholds and then are getting into people's arms. But there's some that have made the gamble to go into production and then have had to be pulled back. I just heard today that South Africa is, stopping giving the AstraZeneca vaccine because it seems like it's not as effective on the variant that they have there. And so there is the gamble that by, starting production earlier because you think it's going to work. But there's also the assurance that if it doesn't, we will pull it back. And so I want people to be assured that the process was followed as it was supposed to be. The science was already there, being lined up even before we knew anything about coronavirus. And so there's safety in that and being able to have the time and attention to it. Usually you do phase 1, and then you would go out and raise some money, and then you would do phase 2, and you would raise some more money, and then phase 3 and raise some more money. And they were able to, collapse a lot of that down, which is how things got out faster.
No, I mean, excellent. Everyone's making excellent points. The mRNA is not a new idea. It's been around for maybe 20 years, waiting for the process has been perfected. And it's actually, the Zika virus was something that they'd actually used it on. So recent pandemics or concerns. And then to Dr. Davis's point, we haven't skipped any steps. We've done multiple steps at the same time. The other thing that takes one of the longest things in drug development is finding people to volunteer to test a drug or a candidate. And as you can see with the interest in the vaccine, there was no problem finding people to volunteer. And then the other thing you have to keep in mind is, sadly, because we have had so much trouble controlling the virus in the community, people who were vaccinated were rapidly challenged by infection. So we got to see very quickly how fast it works. But I would say the 3 physicians and most physicians in the community at this point feel pretty strongly that the vaccine is safe. And it's exciting that it's happened as quickly as it had. I think the other thing to think about, and maybe this is another part of it, so we feel like there's different numbers of the efficacy. So is that a concern for either of you when you're talking to your patients? If I could choose can I choose a vaccine if I'm a patient? Some are 98, 166. How should I think about that?
I would say, at least in the United States, we currently have 2 vaccines, so both the Moderna and the Pfizer. And I believe the data shows that efficacy on them is pretty equivalent. I think it's 94.1% for Moderna and 95% for Pfizer. So I feel really comfortable and confident advising my patients to take either. I took Pfizer, and I think my parents took Moderna just because that was what was available at the time. I think as the other vaccines come to market, then depending on the data, that might skew the conversation. But for now, I feel confident endorsing either.
Yeah. And, I think when you look at in comparison, I mean, like Pfizer 90 to 95% effectiveness, which is unheard of in a vaccine. I mean, the flu shot, if we get, 40, 50%, that's a good year. So even the vaccine having 60, 70% effectiveness is still something to be applauded. But it's also important to remember, you probably are not going to get a choice in which vaccine you get. Maybe we'll get to the point where that is kind of down the line. But I think at this point, if you're offered Pfizer or Moderna, take it. I got the Moderna because that's what my portion of the county was getting. And so I don't know how much choice we're going to get in which one you receive, but know that we do better, in terms of looking at getting to herd immunity, which is the goal, right? Enough people have immunity either through vaccine or through having the disease that it can't spread. There's nobody else for the virus to jump into because you've got protection. That even at a lower efficacy rate, it's still offering protection and it's still helping.
Absolutely. I think the other thing to keep in mind is when you look at what happens to folks after they've been vaccinated in terms of hospitalization and death. Both of these, and even the new Johnson & Johnson, are equivalent, right? They're really close to each other.
Mhm.
It's not worth quibbling over. And you're getting a vaccine to prevent hospitalization or death, right? Not, you might get a case and be mild, right? Perhaps. So do either of you worry, given there is already some geographic distribution of these two vaccines, the current ones, and you can imagine that the Johnson & Johnson will also fill a need for rural areas, for example, and other maybe underserved areas in the United States because of the temperature requirements, right? The first one that came out, I think it's Moderna, is the one that's very hard to sort of take care of. The Pfizer is easier, and the Johnson & Johnson is going to be like a regular vaccine. We'll be able to sort of move it around like we would any vaccine. Do you worry about that in terms of the potential that one of these vaccines or both might be considered less than because it has a different niche? Rural versus urban, for example, which we're already seeing, or even
Yeah,
community
that's
health centers
that's
versus universities. I'm asking.
that's an interesting take. I hope that we don't get there. That's what I'll say. I mean, I certainly could see how, oh, well, if the East Coast gets Moderna and the West Coast gets Pfizer and the Midwest gets, Johnson & Johnson or AstraZeneca, does that set us up for some, one is better than the other, some bi-coastal thing? And I think that folks should look at it as not as, different brands, and really look at it, they are all effective, and they are all helping to reduce deaths and reduce hospitalizations and reduce spread, and not look at trying to pit one against the other, or feel like because your region got X, Y, or Z, that means that your region is less, is being considered less than. I don't see that at this point, especially since at this point we just have two. But I think it's good to bring it up, and I think it's important to follow it, right? You wouldn't want to see that the less efficacious, if there's one that ends up being less efficacious, that is the one that goes to, all of our urban centers, or all of our rural centers, or, places where folks are more disadvantaged. That would definitely be something that we would want to be, watching and keeping eyes on.
Dr. Otiji, thoughts?
Yeah, no, I think that's, definitely an interesting thing to think about, that you raise. Just, obviously we wanted to make sure that we, maintain equity across the board. I think right now, definitely the data supports, all the above. I agree with Dr. Davis. I feel like people should definitely see either and or all of them as, COVID-19 vaccine, just get it. Compared to, like I said, the flu vaccine, which is something that we are all very much familiar with, that some years will have 30% efficacy. And, I get it every year without fail. And I encourage my patients to get it every year without fail. I'm like, 30% is still better than zero. But I think the government is definitely doing, right now, even with the, like you mentioned in terms of regulatory requirements, I think it's the Pfizer that has, the negative, super deep freezer and cold chain that needs to be maintained. That right now the goal is still just to provide it to everybody everywhere. And so people that are in urban centers, more suburban areas like myself, or even in more rural areas, there should still be a place where they can access whichever vaccine that's available to them.
No, I agree wholeheartedly with both of you. I would encourage folks who are listening and watching this to think about the fact that they typically, and most of them, that folks who have children, you don't choose your vaccines. Your vaccines are chosen usually by the practice you go to. And you probably didn't think about it. There are certain combination vaccines that pediatricians use based on the company, based on purchasing that they use. And your kid follows a series, and you don't get to go, wait, hold on. I think the other one might be 3% better, or 8% better, or 10% better. Flu vaccine is another great example. You go to the pharmacist, or you go to the clinic, and or your doctor, and you get a flu vaccine. Unless you're 65 or older, we're all getting some variant or some type of a vaccine that are somewhat similar, but they're not all exact. So we shouldn't, patients shouldn't anticipate they get to choose the vaccine, because that would be a new idea, and that's not the way things work, honestly. That being said, the reality is the more people that get the vaccine, the better. And even if it doesn't have is it 170% and one's 80 and one's 90, the more we can get, if we can get 70 or 80% of the people with that, the disease will slow down, and all vaccines will be equally effective with time, right? Again, doing those two things that we use them for, to keep you out of the hospital and to keep you alive.
Definitely.
So in your mind, and Dr. Davis and I were talking about this before it started, who should get the vaccine and how should we prioritize this? If you're listening, how do I know I need the vaccine? I'm strong. I don't need it.
It's interesting. And so everybody needs it. Everybody's going to need it eventually. Right now, the Pfizer and Moderna have been tested in kids, have been approved for, one is 16 and up, one's 17 and up. Eventually, kids are going to need it too. But it's interesting and really laudable how the government has prioritized who should get the vaccine. And so starting with folks over 75 are in the first category, and healthcare workers, folks in, living in congregate settings, long-term care facilities. And then just behind that are, behind the long-term residents and older folks and essential workers are folks like your grocery store workers and your bus drivers and those folks who are interacting with the public. That is not a group in the past that as a country we have prioritized. And I think some of what you're seeing right now are people who are not in those groups trying to jump ahead and not feeling comfortable with those folks being prioritized, because they should. They're most at risk. That's where our communities of color, that's where our Black folks and our Latinx folks are. And we have seen how COVID-19 is really impacting them. And ACIP, which is the group that recommends, who should get vaccines when, has been very strong in saying this is the group that should be getting the vaccine next. So there's levels 1A, B, and C. And so, and that's 65 and above, essential workers, healthcare workers, and then those folks who are interacting with the public. And so if you're thinking, and then, below that are, younger folks. I think teachers are in that 1B category. So if you're in that, let's say you're a 30-something, you're not falling in that, category 1, so you're probably in a category 2. Your time is going to come eventually, right? Hopefully by late spring, early summer, we're going to be into that group, and you're wondering, should I get it? Do I need it or not? And the answer is yes. And while we have seen that younger folks have had a milder course, I've also seen younger folks die from it, right? And so, and what I worry about more, I've seen younger folks die, I've seen younger folks be in the hospital. I saw, a 17-year-old kid who needed a heart transplant because of, myositis from COVID, right? So it's not that these folks don't have issues and don't get complications. So there's one, protect yourself. Even if you're younger, you still could get a severe case. But even more than that is you're protecting the folks around you. And I liken it to the flu shot. So I have 3 boys, and my middle son was born in October. And I made it a requirement that if you were going to come into my house to see my son, you needed to get the flu shot. Because at that age, he was too young to get the flu shot. And so, but he, being an infant, was the most vulnerable to the flu, and he wasn't able to get the flu shot because you can't get it for at least 6 weeks. And so, the younger people who were coming to visit, or my in-laws, as my mother-in-law, she doesn't want to get the flu shot. It makes her sick. I'm sorry, it might make you a little sick, but it's going to make him a lot sick. And so, when it comes, the bottom line with vaccines is really, it's not about you. Vaccines are about protecting the public and the people around you. And so, getting the vaccine, yeah, it's helping to protect you from getting the disease, but really it's what it is helping to protect it from spreading throughout the community. And so, if you're younger and you're interacting with people, you're protecting your grandmother, you're protecting your parents, you're protecting the people that you live with, the people that you work with. And so, it's important for you to get it for those reasons. One last thing, to say about, who should get it and it being important in our community, and a thing that we don't hear about. So we talk a lot about the risks for folks with heart disease and diabetes and high blood pressure, that you're at, greater risk of complications from COVID if you have any of those. But the other one is obesity. And you are at higher risk for complications from COVID if you're overweight or obese. And there was a study looking at folks who were under 40 who had COVID, and those who had a severe course. They didn't have other risk factors. The only risk factor was obesity. And so that's not something I think that we hear a lot about, but if you are overweight or obese, you want to be thinking of yourself as higher risk, even if you don't have any other health issues.
That's a great point.
Yeah.
Dr. Otiji, anything to add?
Yeah, no, not just to echo everything she said. I think, right now it's honestly the vaccine. We know that the spreaders are the young, healthy people. I mean, the older folks, people are scared to death. Yeah, and rightfully so. From what we're seeing from this disease, it does definitely severely impact people that are older in age, people that have more comorbidities such as diabetes, hypertension, obesity, like Dr. Davis mentioned. And so at this point, most people that fall into those categories are being very careful and mindful, are staying home. But the truth of the matter is that there are other people that live in their home. They are younger people that live in their home, that go out and interact with others, whether it's going to the grocery store to buy groceries for the elderly parents that are staying home and sequestered, whether it is, the younger people that are going out and working or just interacting with other people in the community. And so, as much as we are the older people and people that are at higher risk know that they're higher risk, they don't live in a bubble. And so, we really want to, yes, follow obviously the guidelines in terms of vaccinating those high risk people. But I think, definitely want to start to get that message out that, yes, even the young, healthy, like Dr. Davis said, the 30-year-old, 25-year-old young mom, like these are the people that we really, when that time comes for them to get the vaccine, want to strongly encourage so that we can really get out of this crisis that we've been living in now almost for the past 12 months.
So just a quick follow-up on that, to get out of the crisis, right? Who likes wearing a mask? No one likes wearing a mask, right? So if I get vaccinated, do I still have to wear a mask?
Yes. Still, yes. Still have to wear a mask. Still have to observe, guidelines and social distancing protocols. At this point, yes, we believe that it's safe. Yes, we believe it's efficacious. But at the same time, there's still a lot of unknown, right? I mean, no one can tell you 100% once you get the vaccine, it's impossible to get COVID. There's no such thing. There's nothing that can do that in life. There's nothing that can do that in medicine. And so until we get to the point where the vast majority of people are vaccinated, I'm afraid we still have to mask.
Yeah. And there's a lot of things we still don't know, right? I mean, we don't know, are you going to need a booster shot in a year, 5 years, 10 years? We don't know. Can you get COVID again? Is coronavirus going to be like the flu where, each year there's a new strain and we got to get a new shot? The thought is no, and the thought that this mRNA vaccine will have lasting effects for years to come, but we can't say that with much certainty yet. And so, while the smart scientists and public health folks are figuring it out, we're still wearing masks. I've got my 2 doses in and I'm still wearing my mask. So
yeah, I think it also goes back to what you said, Dr. Davis, is that part of getting vaccinated is for yourself, but a big chunk of getting vaccinated is for other people. And that's certainly true in adult vaccines, such as the flu. And thinking about this as, while it would be very easy for you to actually get the vaccine and not know you were infected and actually be spreading the virus because you could be asymptomatic, right? So that's one reason. I mean, you can think of lots of different scenarios when I've been vaccinated, but you're still spreading the virus. And we don't know that people who've been vaccinated don't spread the virus. So yes, we have to continue to mask, but if we all work together, do our level best to get vaccinated, then there will be a time when there'll be an all clear, and we should probably still social distance and wash our hands, right? I mean, social distance, I guess, is a personal call. I'm okay if people stay 6 feet away from me. That's a personal preference. I'm not a huge hugger. I'm just saying, but we definitely still want to keep washing our hands. But the mask will eventually get to come off. So
yeah. I don't know if I'll be shaking hands for a long, long time. I think it's going to be a long time.
Like the elbow.
Yeah.
I would ask people who are listening to think for a second. Since the cold and flu season started, how many colds have they had doing what we're doing right now?
Yeah.
And that is if you say, well, I haven't had a cold at all, that's because what you're doing is working. Right? So keep it up. And then maybe we all are back to elbows and, well, maybe not wearing a mask, but it depends. Personal preference. How do people get vaccinated? So right now, who are we vaccinating in the United States? It's the 65-year-olds at this point. Even Montgomery County, are we moved to that point now for general people, not essential workers and healthcare providers?
So Montgomery County has moved to if you're going through the health department. So the state of Maryland has said folks over 65, and they are vaccinating in 1A, B, and C categories. Montgomery County, if you're going through the health department, is only taking pre-registration for 75 and older because they just have limited vaccine. The state has also partnered with some local pharmacies, CVS and Walgreens, who they are focusing on the nursing homes. They've also partnered with Giant and Safeway. So if you're going through Giant or Safeway, you can register on the site, and they are taking 65 and above. If teachers, falling into these essential category workers, you have to fall into one of the categories, but then you can go, but they're extremely limited. If you're in Montgomery County, if you go to the health department website, montgomerycountymaryland.gov/COVID, there's a link there for where you can put in your zip code, and it'll tell you all of the different sites that are there and register. So through the hospitals have sites, through Giant, Safeway, yada, yada, yada. I will tell you that those slots go fast. I know that I have been checking back frequently for my parents and grandparents in terms of trying to get them registered. I would encourage you, if you're over 75, to go ahead and pre-register. That gets you on the list through the county's health department, and they'll contact you. Any of you who are teachers in Montgomery County Public Schools or work for Montgomery County Public Schools, they are working to vaccinate all staff. But they just put out a message that they're working in conjunction with the health department, and it's still going to be probably about 4 to 5 weeks before you can get a vaccine through the public school. They've said if you can, if you're able to get it another way, if you're able to actually get onto one of those lists at Giant or Safeway, then to go ahead and do that. But right now there really is there's a shortage. The amount of vaccine that the county is getting doesn't come anywhere close to the demand or need for the number of people that need to get the vaccine.
Yeah, I would say same thing. I mean, Prince George's County, it's, like Dr. Davis said, it's different venues and options to go to get the vaccine, to pre-register for the vaccine, which I think honestly does add to some confusion and frustration. And when patients are trying to, ask about the vaccine, and there's obviously some hesitancy, which, like with anything new, of course we understand. Again, definitely in the Black and Brown community with hesitancy and vaccine hesitancy, definitely understand. And I think, when someone gets to the point where they're like, okay, I'm ready for the needle to get into my arm, where do I go? It has been a frustrating process. So I think what I'm definitely encouraging people is that, if you have the opportunity right now, I feel like through work is probably the easiest site. So people that work for, Metro, and like I said, the teachers, people that work in healthcare centers, different settings, that when they get called up, I definitely advise them to go ahead and take that slot and just get it done. Because like Dr. David,
That's a great
huge
point.
need.
And Prince George has just recently opened it. Sorry,
Yeah.
say that again. Sorry.
No, I said you don't want to give up your shot.
Right. You can. And I'm going to ask a question about that one shot or two in a second. But Prince George's did last week, I think, open a drive-through site. But you can't just drive through. You need an appointment.
Correct.
So one of the things that I've run into, not directly, but with folks I've worked with, is the question of, well, I don't know what a URL is. I don't know how to get onto a website and make an appointment. I don't have a smartphone, and I don't have access to a grandkid who can do that for me. How do you think about that? This is part of unfortunately, our healthcare system is discriminating from the beginning for folks who don't necessarily have access to certain technologies. Have we thought about that? Do you guys have any ideas of how to help people through that?
That's a tough one. I think, even throughout this whole pandemic, as a lot of offices, including mine, are doing virtual medicine, are doing virtual visits and televisits. Right. And so, that does require computer savvy, right? And so, a lot of people have just overnight, have to have learned some skills that they didn't know they had. But it had definitely, it's been challenging, so, but it seems like this is the trend that's going to continue, and unfortunately, you're right. Some people are getting left behind. I'm pretty sure there are phone numbers that can be called, but I think we all know how, if we're not able to get through on a website, can you imagine what the phone would say? So that is a problem. It's a problem.
Yeah, it's definitely a problem. And, I think that the challenge to the county and the state is, right now we're vaccinating tens of people, dozens of people, maybe scores of people a day, and we need to be vaccinating thousands of people a day.
Right.
Large scale, we need to be doing large scale drive-throughs. I think they're looking at FedEx Field to do, large scale drive-through. I've heard about using admission centers to, run folks through. And I am hopeful that those plans will be coming out soon. I haven't seen them yet, but I hope that, that's really the direction that we need to be going, that we're, and we need to be bringing it to people in their community, and it can't just be come to X, Y, or Z between 10 and 2 on a Wednesday afternoon, right?
In your private car.
In your private car that you have to drive to. The high school up the street from me is a vaccination center, and I drove by one day last week, and they had people standing outside literally around the block in line for it. And I said, well, you know what? My 102-year-old grandmother is not going to stand in that line for an hour.
No.
So if you're prioritizing folks who are 75, how are you going to get it to them? You need to get it to them in their house. You need to bring it to them in their community. You need to put it, don't just make it close to a bus stop. Let's take a bus and put it in a community that needs the vaccine and say, we're going to be here from 5 to 10 p.m. Come get your vaccine, really thinking intentionally about how you're going to bring it to folks, how you're going to bring it to folks who have to work, be at work early in the morning and late at night, weekends, evenings. It doesn't stop for holidays. This is something that is that important.
Yep, that's a great point. And we are going to be working on this. That's really good chance that a year from now we're still finishing this work because of the barriers and the vaccine supply. We have 2 minutes left, and what I'd really like to do, because when Dr. Davis and I did this previously, she gave a great closing. So I'm going to see if she can do that again. But if you could just talk to the folks who are listening here and make your plea, make your pitch on why they should find a way to register or pre-register so they can get their vaccine.
So I'm going to close out by talking about side effects, because I want to make sure that I put this plug in here about side effects, and people are worried about getting the vaccine because my arm's going to hurt, or I'll be sick, or I'll get Bell's palsy, or I'll die. You hear about these cases, and I'm someone who actually had Bell's palsy. I still have it. You can see it in my face. And when I heard about the vaccine and maybe an increased risk for Bell's palsy, there was still no hesitation that I was going to get it. As I mentioned, my 102-year-old grandmother, who I haven't been able to give a hug in almost a year, even though she lives literally 2 blocks away from me. It's about protecting her and making whatever time that she has left, she's able to spend with the family and friends who are around her. She is a very social person, and she's with it at 102, and people have not been able to come in and visit her. And so she's had to spend her last, I don't know how much time she has, but almost a whole year in isolation, because we don't want her to succumb to coronavirus when she is otherwise very well and healthy. And so, my passion is for you to get the coronavirus so that your grandmothers and your parents are around to see more birthdays, more New Year's, more Christmases, to spend time with you. That is really important, and that's why we want them around. That's who it's affecting the most. And while I may get a mild course, it's those folks who are around me that I am really trying to protect.
Great point. Dr. Otiji, last words.
Last word. So definitely everything that Dr. Davis said, it's, get it for yourself, get the COVID-19 vaccine for yourself, get the COVID-19 vaccine for your family, for your community, get the vaccine so we can get back to life. Trust the science, trust your doctors, trust your healthcare sources. We don't know everything. We cannot know everything. We will not know everything, but this is good. This is good. Hear what we're saying. We are all living this together, and we want to get out of it just as much as everybody else.
Exactly. Exactly. Let's get the vaccine, get it for yourself, get it for your family, encourage your neighbors. Let's get it together and get our lives back together.
Amen.
That's a great point. Again, thank you very much for joining us today on Afric Today. Remember, you can get Afric Today through the app. You can also watch on Roku as well as Fire Stick TV, and it's also available on the web. Thank you very much. We appreciate it.
Thank you.
Thank you.
Have a great evening,
I
guys.
learned a ton. Thank you very much.
Thank you.
Have a good day.